Health Watch, a new report finds that we're doing a better job treating cancer in the United States. Five-year survival rates for many forms of cancer have jumped significantly. Our medical expert, Dr. Kevin Campbell, joins us in the studio with details. And Dr. Campbell, tell us about the latest study on these survival rates.
You know, the latest report, and it was published in the Journal of the National Cancer Institute, looked at clinical data collected from like 75 to 2014. And we've really made great strides in decreasing the number of deaths caused by nearly all types of cancer, with the exception of two, cervical and uterine cancer. So overall, it's great news.
All right, and we're talking about this good news. Talk about where we made the biggest gains in survival.
The largest increase in survival rates were noted in leukemia, non-Hodgkin's lymphoma, myeloma, prostate and kidney cancers. The number of patients who survived these forms of cancer increased by 25% or more. Other cancers that were on the list of greatest survival were thyroid cancer, melanoma, and breast cancer in women. And a lot of that has to do with the much better job of screening that we're doing for all of these.
All right, and which cancers, though, were not shown to have an increase in survival rates during this study?
Unfortunately, we've really not made a lot of progress in the 5-year survival rates for ovarian and uterine cancer. In addition, cancers diagnosed between 2006 and 2012 that had the very lowest survival rates were those of pancreas, liver, stomach, esophagus, and brain. So we have a lot of work to do.
And what can we continue to do and doctors continue to do to fight cancer?
You know, I think it's really important to remember that everybody has to engage with their primary care doctor. Make sure you're getting the screening test you need when it's time and when it's recommended. In addition, I think it's really vital that women in particular see qualified OBGYN providers to get screened for uterine and ovarian cancers. You know, we're developing new treatments every day. This is essential to better outcomes, but I think focusing on prevention and increasing survival for these cancers through early detection is going to be critical.
All right, Dr. Campbell, cancer is such a devastating illness. We all know someone affected, so
yes, we do.
Such an important research going on. Thank you so much for joining us.